today is the day. Surgery is happening this afternoon. I am quite nervous. Even though I have to like fast and not eat for quite a while, it's not really that long. It's like from 7 a.m, which is fine. It's an afternoon surgery. Even if there wasn't that restriction, I don't think I could eat because I am all butterflies in my stomach. I'm hoping that everything goes well. It's kind of annoying because they haven't really told me much about the surgery at all. Like, I don't know how long it is. I don't know if they are putting in a catheter or anything like that, and I really don't want that. So, like, there's a lot of discussions that haven't been had yet, and I'm hoping that they'll have those discussions when I get to the hospital. I do have to pay like an extra admission fee because they billed me incorrectly, and so I have to pay an extra like $700 when I get there, which is really irritating, but you know, what can you do? Apparently there can be really long delays, and I was already going to bring things to do because I've worked in healthcare. It's always slow. Like, things just don't happen when anyone says they're gonna happen. I am bringing my Kindle. Mitch is coming, I don't know for how long. I don't really want him to wait there the whole time because he still has exams and assignments and stuff. He's sort of at that crunch period still, and I don't really want him to waste a lot of his time just sort of sitting there waiting. I do have to have an overnight stay in hospital, so I will be packing my bag, and of course I've been kind of procrastinating the morning away a little bit, watching YouTube videos and just sort of chilling. I'm trying to sort of keep a little bit mobile because won't have that very soon. You can tell I'm nervous. So I just want to document this journey. You never know why I would want to document it. I might have a worse time in my life, maybe somewhere down the track, and I'll look back and think, wow, this was so much easier in comparison. Who knows? I do want to document this, and thank you for being so kind and compassionate. In my previous video, you guys have been, or in one of my previous videos where I was talking about how I'm struggling a little bit with this idea of going into surgery, you've all been just so supportive, and you've had such beautiful messages and comments, and I really, really appreciate that. It's been really nice to be surrounded by such a wonderful community, and I really hope that all of you guys also have really good times with your experiences in healthcare and any other tough challenges that you may be going through. I hope all the best for you guys. So thanks for coming along for this journey. I hope it goes smoothly. So we made it. We're in the waiting room after doing some extra paperwork stuff. I've got to fill out like this online questionnaire thing. I think it's just to update the specialist to make sure like nothing has happened in between when we've last spoken. just woke up. All this bruising here. I don't know what that's from. I can't feel my bum. Apparently they did a spinal and they don't do that for everybody, but I cannot feel my booty at all. It's weird. I don't like it. We're sort of looking into what happened with the spinal because I don't remember on the consent form it saying anywhere that I consented to having a spinal, and I wouldn't have, depending on the reasons that they are offering. If it's just for pain, I wouldn't have wanted it. And I didn't really get a choice when they did the spinal because the anesthetist put the cannula in my arm and then like injected some drug, and he didn't tell me what it was. And then he started mentioning, oh, we're going to do a spinal, then we're going to do the general anesthetic. And no, he didn't say that. He said, I'm going to put a needle in the sciatic nerve just on my right thigh to like block to that leg. And that was chill. I was like, yeah, that makes sense. And then he said, we're going to do a spinal and then we're going to do the general anesthetic. And the drug that he put in my hand was making me feel really woozy, and it was really hard to concentrate, and nobody asked for my consent with the spinal. So I'm just looking into it as to, was it on the consent form and I just didn't see it? Was it my mistake that I signed it and I missed it or something? Although I don't remember it being on there. Do you remember it being on there?
I don't remember it being on there, no.
I can't walk for a lot longer, and I can't feel my bladder, I can't feel my stomach, and I can't lift my leg or anything because of the spinal. And none of this was discussed with me, nor was their consent obtained that I can remember. When I went into theatre, they just sort of started telling me to do stuff like, you know, bend forwards and stuff, but it's so cloudy and my mind was so like foggy from whatever he put in my cannula, which he still didn't tell me what it was. So I'm just looking into it because I think it's not quite right that that's happened. I just don't feel like I had informed knowledge to give informed consent, nor was I in a state of mind to give consent after he gave me whatever it is he gave me, which he also didn't ask consent for. So I'm not very happy with what's happened. But apparently the surgery went well, so that's a bonus. It's like, I think 12 o'clock on the dot PM, so which means it's the start of Halloween today, which is fun. Got my trusty, I've called him Henry, my fluid bag, and I've got a standing walker. I forget what these are called, but you like use your elbows on them and they propel you forwards. I'm already meant to be like walking on my knee, which is kind of cool, like with obviously this assistance. One of the nurses did help me made sure I could stand up and everything, wasn't gonna faint or anything like that, which I don't. I feel fine, I don't feel dizzy or anything. So now I just thought I would freshen up. She helped me get into my pajamas, and I've just got my little bag down here of all the good stuff. You know, all the good stuff, face wash and all that jazz. So I'm just gonna wash my face, brush my teeth, that kind of thing. Now that my butt isn't 100% numb, it's still very numb, but it's not completely numb. So that's really good. And that's where we're at. Nothing has yet come of the whole spinal consent issue. No one's come to talk to me about it, and that was like 2 hours ago. I know it's in the middle of the night, so I don't really know what the nurse was saying about how, like admin, she said at about 10 o'clock when she was sort of getting ready to leave her shift, admin was gonna come talk to me about it. and she said hopefully they'll be here soon. And I don't know what that means because no one came. Like, maybe, did she mean soon, like tomorrow? I mean, technically that's today because it's like past 12 o'clock. It's very interesting, and this night nurse hasn't said anything about it. She didn't even introduce herself. It's pretty typical, I think, in healthcare these days. Unfortunately, poor Mitch is worried sick. He didn't want to leave, but he looked so tired, like he was worrying the whole time I was in surgery. And I feel kind of bad for him. Hopefully, everything sort of gets sorted tomorrow, and it's all G. I'm kind of in this mood where I want to watch a movie. But I don't have anything to like watch a movie on. I guess on my phone. I have Disney Plus on my phone, so I could probably watch something there. But I don't know if I want to watch something from Disney. Don't it look great in my new ride? Good morning, world. Did not sleep practically at all. Maybe like 2 or 3 hours, maybe. Got a nice window. I'm gonna get up and brush my teeth, get myself sorted. Leg is still attached. I'm feeling loads fresher. You know, even did my hair a little bit. So now I just basically wait for people to come see me about discharge. Don't know what's happening with the consent of the spinal. Again, no one has mentioned it still, which is kind of disappointing, but I'm hoping someone will bring it up, or I will bring it up this morning when I see someone who can actually get the paperwork, apparently. Just a few pieces of fresh fruit for breakfast. I only ate the banana. But I'm very hungry, really. So, just had a chat with Dr. McEwen. I feel way more reassured about the spinal. He explained that the reason they do the spinal is actually for the spinal cord stimulation post-surgery. So when you wake up, because the spinal cord was so stimulated, even though you're under general anesthetic during the operation, as soon as you wake up, your spinal cord is still trying to fire the amount of pain that it just keeps building and building because you're not responding because you're on general anesthetic. And that can cause like worse recovery and stuff because you're in so much pain so quickly, and it's just slows down the process and increases risk of DVT, which is blood clots in your legs in particular. So I feel very reassured having a chat with him. That was the conversation I needed from the anaesthetist that I did not receive. He did say that he can give some feedback to the anaesthetist, but he recommends that I actually give them a ring and give them some feedback. So I'll probably do that at some point because I think it's important for future people going through a similar thing that they do understand why they're having things done. I'm still not super sure about the mystery medication cocktail that the anaesthetist gave me, but apparently it's very standard and there's actually no consent forms for anesthetic. It's only if you consent to the surgery, then you by definition just consent to any anesthetic that the anaesthetist decides they want to give you, which seems really weird and odd, and I don't know how I feel about it, but that's how the healthcare system works here, and that's something new. I wish I knew that earlier and that I understood the process of why they were doing stuff, because I would have been a lot more reassured and a lot less worried after the surgery, feeling kind of violated and taken advantage of and not treated as if I was autonomous. So I'm really grateful for Dr. McEwen. Amazing, amazing man. And I truly appreciate everything that he's done. He's done an amazing job and I would recommend him because he's also very reassuring. He's quite to the point and sort of, I guess you could say, stricter, but I appreciate that because it feels honest, which I really like. So that's really good. Apparently the physio is going to come see me soon, and then someone will come give me an appointment card for seeing Dr. McEwen again soon to check my knee and stuff. Yeah. We're gonna get to the door. I did make it back home. Today is day 2 post-op, and I think things are going okay. It was a bit hard to sleep last night. Do you know how hard it is to sleep with your leg, like, sticking up in the air and trying to keep that balance and then still be able to kind of move in bed? So sleep is not amazing. Most of the time it's pretty good. At the moment, you would have seen I have my delectable ice bucket here, in which about once an hour, or if the ice is kind of not very cold anymore, then maybe a little bit less than once an hour. But if I actually keep the ice up and full, should be about once an hour, I refill my cryo cuff. And it's just a gravity fed thing, so you just have to lift it up and hold it lower than your leg and drain it and then refill it. The reason that we don't use ice packs, as far as I'm aware, is because they've actually cut nerves around my knee, and there's still like a sensory nerve blocker working around my knee. If you use ice packs, you can actually burn yourself because you can't feel how cold it is exactly. I can feel a bit. It's just like there's a lot that I can't feel around my knee. So feeling is coming back, but pretty slowly and not in every part around my knee, but apparently that's pretty normal. And I may never get full sensory feeling back around particularly the lateral side of my knee. And that's just because the way that they have to operate, they do have to cut through some nerves or damage some nerves instead of damaging really important things like blood vessels. That's my understanding. I'm not super familiar with the whole process. At the moment, I've been kind of just lazing around a bit, doing the exercises that I've been told to do, you know, sort of pumping my foot up and down, and also stretching out my hamstrings is very important. Particularly, the doctor was saying stretching out the hamstrings, so for full extension. He said because if you don't focus on that early on, then you can actually lose the ability to extend your leg fully if you don't do that really, really early on. So I've been doing that very frequently. Interestingly, something I wasn't expecting was that it feels more comfortable the more extended my knee is, and my whole leg in general. The more extended it is, the more comfortable it is, and the less that it aches. Which you'd think it would be the other way around, like if it's kind of bent a little bit, it would feel better, but it doesn't. So that's what makes sleeping kind of challenging, because I have to put a lot of weight of my leg onto my ankle so that my knee kind of hangs down and keeps it in that nice extended position. Whereas if you just have pillows and then your knees kind of over the pillow, that ends up aching quite quickly. It's a bit weird. I've only been taking Panadol so far. I have stronger stuff that the doctor has given me, but he very much emphasized that the cryo cuff and elevation and just keeping up with Panadol when I need it are the main things that will prevent needing further pain medication and pain relief, which is good. So I've been really onto that because I don't want to take anything more than what I absolutely need. A really cool thing actually was that I could walk. As soon as the spinal wore off, I was able to walk straight away, like full weight bear on my knee. And it doesn't actually hurt to walk, which is strange. I thought it would, but it doesn't. It doesn't hurt to walk. In fact, it probably hurts more when I'm resting it than it does when I'm walking around. Obviously, if I walk around for more than probably like sort of 5 to 10 minutes, I try to not walk around for very long because gravity or the fluid goes down my leg, and that does increase swelling, and so the swelling then causes pain. But to reduce swelling, I don't walk around very much. Like, I have to move around at least sort of once an hour or every 2 hours. When I say walk around, I just mean like get up or sit back down or just change positions or something. Often because I have to change the cryo cuff, so I have to move around for that. Yeah, I'd say the most, I guess, inconvenient thing at the moment is that I have to keep my leg raised majority of the time, like 80 to 90% of the time. It just becomes uncomfortable. It hurts my back and stuff because to be seated on a couch or at my computer or whatever, I kind of have to be twisted to be able to have my knee up. So that does sort of create an annoying sort of position. And that's another reason why I have to sort of reposition myself, because my back gets sore, because it's actually really hard to keep your leg up and your back straight at the same time. So what I'm currently doing with just the elevation, the cryo cuff, and then, you know, intermittent Panadol, particularly elevation, that stuff has to be prioritized for 12 to 14 days to ensure that I don't get swelling, because swelling is the enemy, apparently. Swelling causes pain. Pain means you have to have more medications. More medications affects your mental state, like narcotics and that kind of thing can make you very drowsy and kind of put you out of it, make you a bit high. That kind of thing, if you get to that stage, then your mobility will be less, and it's just kind of a slippery slope to a slower and slower recovery. So I'm really trying to keep very on top of everything that the doctor has recommended so that I don't go anywhere near that slippery slope. So far, I think I'm going pretty well. I actually got a decent amount of sleep last night because post-surgery I got probably 2 or 3 hours sleep just because I wasn't tired, and I just, the spinal felt so weird, and it's like I couldn't sleep with it, and it was just, it felt like you weren't control or feel or understand your own body, which was just bizarre. Still, something at the moment is that I can't feel my stomach very much still. I can feel my bladder, but still not as well as I used to, I think. I'm not sure if this is a normal thing that happens after you have a spinal. With my stomach, it's very difficult to tell whether or not I'm hungry or I've got anything in my stomach or I'm full. It's like you just can't feel your stomach very much. It's a really bizarre feeling, but I can feel it just very faintly. So I don't think I've been eating as much as maybe I should. I'm not super sure. I have been eating, but not a lot, because I can't feel my stomach, so I don't feel hungry a lot of the time. I have a feeling that it'll come back more and more over time, but I don't know, no one's talked to me about it. Bladder, kind of similar thing, except I can feel it a lot more than I can feel my stomach. That's pretty much it for what is happening at the moment. Apparently the surgery went really well from everything the doctor said, and I didn't need the extra, I think it's called an LET, but like the extra lateral ligament that sometimes they put in as a preventative measure for another ACL tear, but my ACL tear didn't damage enough that I needed that, from what Dr. McKeown was saying, which is really good. So it probably means that my chance of having a recurrent ACL rupture is lower than what it would be for some other people. Mitch has also been very good. He has been kind of flittery. I don't know what you call that, but you know where they hang around all the time? Like, what can I do? Please, let me do something. Always hanging around wanting to do things for me, but I'm pretty good most of the time. Often it's kind of things like, can you just adjust this pillow on my leg because it's annoying to stretch over into it? And food and doing stuff for the animals and stuff, it's all very helpful. All in all, I am on a good road to recovery, I think, from where I'm at the moment. And I am looking forward to future mobility. It's gonna be really exciting when I can run again for like the first time in 6 months or something ridiculous. That would be really exciting. But I'll keep you guys updated on what's sort of happening with recovery. I'm not super sure how this is going to impact the most recent upcoming videos, just because I am kind of constrained a little bit to what I can do at the moment. But feel free to drop some ideas into the comments, and yeah, I hope you guys are all having a good time. Look after yourselves, and I will see you in the next video. Bye, friends.